Hey guys, welcome back to Allied Health 209. And we're now moving on to immunology, which is chapter 7. Okay, so our next test is going to be on chapter 6, chemistry, and chapter 7, immunology, right? And we talked about how, your next, that'll be test 5 on chapter 6 and 7, chemistry and immunology. The chemistry PowerPoint presentation is already up, it's been up, so hopefully you guys, when you're reading this one, you would already read chapter 6 in your textbook, watched the chemistry PowerPoint presentation, filled out your review guides, and you have been studying chapter 6 all along. Once you finish doing the same for this chapter, then I will also put up, probably sometime during the fall break, the PowerPoint presentations for chapter 8. But remember, you will not have an individual test for chapter 8, but you will be responsible for the material. As you know, it's a comprehensive lecture final, so there may be some questions from chapter 8 on that final. You guys also have a study guide or review guide for your lecture final, okay? But again, you know how I always say, you can't eat the steak whole, you got to cut it up and eat it little pieces at a time, right? So let's focus on getting past test 5 on chapter 6 and 7. So let's go ahead and jump right into immunology, because just like chemistry, unfortunately, this is a very long chapter because this is a very detailed topic, guys. It can be interesting if you like this. I do actually like immunology, and I hope it's interesting to you guys. Like I said, get your black binder out with your review guides out and fill them out as you're going through this. Now remember, I'm going to move pretty quickly, okay, because I know you guys don't like me to spend that kind of time. I know it's long to sit through. We talk about it in lab class all the time. But I also want to get you all the information you need so you can be successful on the test, okay? So let's just go ahead and get started. Okay, here's some review questions. I'm going to go through them real quick because the reason I have them on here is for you guys to use them as study tips. So I'm going to just kind of breeze through them quickly, but what you guys could do is pause it on each question and then see if you're getting the answer correct. This will be a good way, like flashcards or Quizlets, for you to really test your knowledge to make sure you're getting the right thing. So let's go through these real quick, but I'm going to give y'all enough time to be able to pause each question and then see if you answer, and then you can start it back up and see if you're getting the right answer. So let's pause this one now. Okay, guys, these are some great review questions from chapter 6 in chemistry. So let's move on and do some more. Okay, now, like I said, guys, those are like flashcards or something. Those are just some questions just to refresh you on chapter 6 that you just finished, and you can use them a way to study if you like to, okay? We always start with our learning objective, right? Because these are the things that when you finish reading chapter 7 in your textbook, you finish watching these PowerPoint presentations, you study, these are the things that you should know, right? You should be able to explain the immune process. all the way down to explain how titers are used by physicians, okay? And all that in between. These are also listed in your textbook, so make sure you read over these. We always start with our key terms. And again, these are terms that you're going to need to know, right? If you're going to be a healthcare professional, you need to be able to understand the language and speak the language professionally to patients and your coworkers. So guys, we're going to go through these quickly. You can pause them and see if you're getting the right answer. So pause this one now. Let's get started with some fundamental concepts, just a basic overview of immunology, which if you've taken anatomy and physiology, this will be kind of a refresher from that. We understand that our immune system protects our body from different things, everything from viruses, pollution, toxins, and parasites, and all the stuff in between, right? This is our internal systems that help us protect ourselves. Let's start with the antigen antibody situation, okay? So first and foremost, what is an antigen, right? An antigen is a substance, okay, like the bacteria or the virus or the cancer or whatever that is perceived by your body as foreign, okay? So that virus like COVID-19 comes into your body, you inhale it in or, excuse me, you touch a surface and touch one of your mucous membranes, and now that COVID-19 virus has gotten into your body. Excuse me, guys. So your body sees the virus and says, alert, this is foreign, right? So then what is an antibody or an immunoglobulin? An antibody is a protein produced by your body after it detects the presence of that, what it sees as foreign antigen. So how does an antibody work? They are specific for each antigen, okay? They attack the antigen by forming an antigen-antibody complex, and they destroy or render the invader harmless by agglutination, which is clumping, or by lysis, which is destroying it, okay? So it sees that this is a foreign body. Your body produces an antibody to it. Now, unfortunately, the first time, then you get sick with it, right? But then, like, you get a cold, right? So, or you get some disease, you get chicken pox, okay? A lot of times when I was young, before they had the chicken pox vaccine, we would get around another child, we would be exposed to chicken pox, we would get chicken pox, we would hopefully get better and over it, and then now, if we came across another kid with chicken pox, we wouldn't get it the second time. This is how it's worked, right? Most of the times in a good situation. Because what happened is, when I came around that child who had chicken pox, I'd never had chicken pox before, right? So the chicken pox got into my system, okay? It was that antigen, right? And when my body saw it, it made an antibody to it and started trying to fight it off. But a lot of times, because it's a new foreign system to you and you don't already have that antibody in place, you get sick with the chicken pox, but the antibody works its way up and is able to cure itself, right? You get better. But then now you have this antibody in your blood and it will recognize that antigen the next time it sees it immediately because it's specific to that chicken pox. And if you come around it again and it gets in your bloodstream, the antibody can destroy it by agglutination or lysis before you ever get sick, so it prevents you from getting it a second time. So now here's that section in your black binder when you're filling out your review, guys. And this is just a section, guys. you really have to learn to start describing things in your own words, okay? Not to mention, you know, there may be places on the test where you have to describe something in writing. So in your own words, you want to talk about how antibodies work to protect our bodies from foreign invaders like viruses and cancer cells. You want to make sure your answer contains that antibodies are specific to antigens, right? Substances the body views as foreign, and antibodies attach to it and try to destroy that antigen. So how do immunology tests work? They use the fact that specific antibodies will attach to specific antigens to detect their presence in the blood and or body fluids. Antibody antigen testing is a rapidly expanding laboratory science called immunology. So think about this. What is an antigen? Pause this and see if you're getting the right answer. Remember, the antigen is the invader, right? It's the foreign substance that comes into your body. What's some examples of a foreign agent that's an antigen? We know, right? Bacteria, cancer cells, toxins, allergens, right? What's an antibody? The substance produced by the immune system to destroy that specific antigen, right? What's some examples? The antibody against a specific bacteria, virus, or cancer cell, right? And we're going to get into this about being vaccinated, right? They vaccinate you so that your body will produce antibodies to the flu, so that when you come in contact with the flu, it can quickly get on top of destroying it so you don't develop the flu. Now, this would have been a role play that pre-COVID, if we'd been in the classroom, we would have played out, okay? But if you have somebody, especially a child in your home, you can play this game with them, right? One person will be the antigen, and you'll decide what you want to be, a virus, bacteria, whatever, and one will be the antibody, okay? And then what kind shall she be, okay? Role play what will happen when the antibody finds the antigen? So if you decide to be the antigen and you're a virus, and then your body, you come into the body, that body is going to produce that antibody, and then it's going to grab a hold of that antigen. So you can play that game with your kids. It might be something fun to do to break up the monotony. Okay, so overview of immunology. We're still talking about just a broad overview, right? So what is the name of the section of the lab that does antigen antibody testing? It's the immunology part of the lab, or they could sometimes refer to it as serology. Immunology comes from immunoglobulins. Serology comes from the serum because antibodies are found in the serum. So here's one of our case studies, right? This is where you take the things you're learning in lecture and lab and put them together in a possible scenario you could come in contact as a clinical student or as a medical assistant out working. So pause it, read through the case study, and see if you're getting the right answers. Pause it now. Okay, guys, now we're going to move on and start talking about vaccination and or immunization, okay? This is really important right now. There's a lot of talk out there about immunization and vaccines, right? So the process of injecting harmless or killed microorganisms into the body to induce an immune response, right? And it's against potential pathogens. So we want to get the bodies to produce these antibodies. It's like I told you guys, yeah, we could get the chicken pox and be miserable and run the risk of having other serious complications. Children had died of chicken pox. And no, most people got chicken pox and they didn't die. But again, I've told y'all many times, I'm not a gambler, right? Especially with my life, right? So instead of running the risk of having these children get gravely ill and have conditions they have to live with the rest of their life and possibly die because of chicken pox, we made a vaccine against chicken pox. Because there's two ways you can do it, right? You can come in contact with chicken pox or measles or mumps or COVID-19 and you can get sick, and your body will build up antibodies against that antigen of COVID-19 or whatever it may be. And then hopefully it's the type of virus that the next time you come in contact with it, your antibodies will be built up. It will immediately see that as that antigen. It's specific to it. It gets on it, attacks it immediately, and you don't get COVID-19 ever again. Okay? Now, we have a lot of talk about, vaccinations and should I be vaccinated? Should I get my immunizations? Guys, it's vitally important to do this. The only thing that we've been able to eradicate in this world, which means no one has it anywhere ever. We never get cases of it, okay? It's like I've talked to you about things like endemic. If something is endemic, like malaria in areas in Africa. There's places in Africa where there's just that low rate at all times. They have about X amount of people with malaria at all times, okay? We haven't been able to completely eradicate malaria all over the globe, right? And then they may have spikes where all of a sudden, due to maybe the rainy season or something like that, we have a spike and all of a sudden a bunch of people start getting malaria above what's just that regular level. Now what we have is an epidemic of malaria. So we need to go into that region and figure out, is it because it was a monsoon season? There's a lot of standing water. What do we need to do to get those numbers back down? And then sometimes you have a situation where we have right now where it's a pandemic, right? And all these people are sick all over the globe in high numbers with COVID-19. Now, some immunizations, like the one we have for smallpox, work so well that now no one ever has smallpox, okay? Now, what you're hoping for at least is to get to the point where it's things like mumps and measles and polio. We almost never, now we haven't eradicated polio. There's still in some third world nations, there are people, because they're not being immunized, they will come up with polio from time to time, but the numbers are very low, and in the U.S., they're very, very low. It's because we immunized our children, okay? And so now a disease that crippled so many now doesn't do that anymore. That's why vaccinations and immunizations are important. There used to be a time when mumps and measles and smallpox, all these things were deadly and harmful to people. But because we got our immunizations, then I don't even know anybody that's ever personally had the mumps, okay? Because they were immunizing and giving vaccines from the time I was born. So a lot of these diseases, the numbers were so low down, we never even saw anybody with these diseases any longer. So this is really important. You have to understand these are harmless. They're either dead microorganisms or there's something that will make your body think it's that. People say, well, I got the flu shot and I got the flu. No, that is absolutely impossible, okay? I'm sorry. Now, because your body has an immune response, okay, it's like when you take your baby to get a lot of their vaccinations or immunizations. Sometimes they'll tell you your baby may be cranky for a few days and you might need to give them some Tylenol. It's not because they've developed the measles or the mumps or diphtheria, because they haven't, but because their body is working overtime to build this immunity. It may wear them down a little bit and make them feel bad and they feel a little weak and tired. That will happen, but that's okay because we're saving them from these sometimes deadly, very harmful diseases, right? So remember, immunization makes the body produce antibodies against the substance in the vaccination, okay? If the killed flu germ was injected, and remember I said dead flu germ, so it cannot give you the flu, but it was injected in a person, would form antibodies against that flu. Now the reason we don't have really, and hopefully there's a silver lining in everything, we're learning a lot off the new way they're genetically doing this, doing these vaccinations for COVID-19. So maybe we'll be able to implement that technology into making new flu vaccines that have a better outcome. Because we all know that they're guessing at which flu we may get this season. And so you get a flu shot, okay? Now you may feel a little bad afterwards. That's from your immune response. And then people say, I got the flu shot, and then a few days later I ended up with the flu. It didn't come from the flu shot. What most likely happened is you were around someone, didn't realize it, that had the flu, and you already had the flu when you got your flu shot. Or sometimes you'll get your flu shot and then sometime later you get the flu. It's because you were immunized against one strain of the flu virus, but you came in contact with a different strain, so you didn't have the antibodies against that one. So always keep that in mind, okay? Guys, if they're tested properly, if they follow all the rules and regulations and guidelines set out by the FDA and the CDC, and they do legitimate work, but the scientists do, and they test and test and test that vaccination before they give it to the general public, and it's 94% or 90% effective, then we may be able to get this COVID-19 under control, okay? But it's part of their job, if done properly, for this thing to be safe for the general public when they release it, okay? So what is an autoimmune disease? Okay, we hear a lot about this, right? That's a disease in which the body produces antibodies that attack their own body tissue or self-antigens, okay? So we know that we can come in contact with the disease and we may get sick, but while we're getting sick, our body produces an antibody, so if we come in contact with it again, it can prevent us from getting sick, or we can be vaccinated against it, so we have the immunity from the dead virus, right? Then there's also called autoimmune, okay, against yourself. That's when, for whatever reason, your body sees your cells in your pancreas or some other tissue as foreign, and it starts attacking its own tissue. So let's look at the first line of defense, okay? So the first in our immunity, right? The first line of defense, natural barriers, okay? The overall immune process that occurs as the body protects itself is viewed as 3 lines of defense. So the first line of defense is non-specific natural barriers that stop invaders from entering in or growing on the skin and the mucous membranes. So we have 3 examples of how the first line of defense works. You have your skin and mucous membranes. They secrete chemicals that maintain an acid pH of about 5.6. This discourages the growth of pathogenic bacteria while allowing the growth of normal flora. The mucus entraps foreign organisms, and coughing and sneezing is a way for our body to get foreign organisms out, right? So we breathe in an allergen or pollen, right? And our body's like, oh, that's not good. And it makes us sneeze to get it out of our nose so that it doesn't get in our body and make us sick, or it tries to, right? That's a part of that natural barriers, that first line of defense. So here's one of our case studies. So you guys pause this now, read through it, and see if you're getting the correct answers. Okay, now we're going to move on to the second line of defense. So what is the second line of defense? The non-specific internal response that occurs when invaders pass the first line, to get past the first line of defense. It is generally seen within the first 12 hours of you being infected. So here's some examples of our second line of defense, okay? You're going to need to know these. WBCs, right? They go out and they engulf or destroy the invaders. Neutrophils engulf and ingest the invaders by phagocytosis. Monocytes leave the bloodstream, become macrophages out in the tissue, and ingest the invaders by phagocytosis. And the special lymphocytes called natural killer cells, or T8 cells, attack and destroy the body's infected cells and cancer cells in a non-specific way. So y'all make sure you understand these about what the WBCs do, how they can engulf and destroy the invaders, and there's 3 of them. There's neutrophils that engulf and ingest the invader by phagocytosis. Monocytes can actually change into macrophages. And when they change into macrophages, they're actually able to leave the bloodstream, and they're like a cleanup crew. They go out into the tissues and they ingest the invader by phagocytosis and do away with it, right? And then we have those natural killer cells, or T8 cells, that attack and destroy the body's infected cells and cancer cells in a non-specific way. And those are the lymphocytes. So here's another one of these thinking slides. I want y'all to name 3 white blood cells involved in the second line of defense. Pause it and make sure you're getting the right answer. So make sure we're going to learn, and I want you guys to know the difference between the non-specific and the specific. So now we're going to move on. We're still talking about this second line of defense, right? Non-specific internal response, right? We need to know the difference between the first line of defense, the second line of defense, and we need to know the difference between the non-specific and the specific. So 2 protective proteins become involved, okay? Interferon, which is a protein secreted by infected cells to prevent their further replication and the spread of infection into neighboring cells. Okay? Little study tip is interferon interferes with the spread of infection. Then there's complement proteins, proteins that further stimulate phagocytosis and inflammation and are capable of destroying bacteria by punching holes in their membrane, causing them to fill with fluid and explode. Okay? So know about interferon, know about complement proteins. This is still in our second line of defense, and this is non-specific internal response. So pause these now and see if you're getting the right answer. Okay. Now let's talk about the inflammatory response. Okay. So when it's initiated, it usually gets a little warm, and redness and swelling and pain can occur in that area, right, when it becomes inflamed. Histamine is released by those injured cells, causing the dilation of blood vessels. The increased blood flow to the affected area results in redness and heat, and fluids in the plasma leak into the tissue because of the increased permeability of the vessels, causing swelling and pain. So the inflammation process is what happens when your body is trying really hard to fix what's going on, right? But your body's being overwhelmed is what's happening, okay? So pause these and see if you're getting the right answer. Okay, here's a case study. Again, guys, I want you to be able to take what you're learning in lab and lecture and see if you can use it out in the field. So pause this one, read over it, and see if you're getting them right. Remember, if you're running into any problems, reach out to me. Remember, we talked about white cell counts in lab. Remember, only the third line of defense is specific. Okay, now we're going to talk about that third line of defense, okay? Adaptive and or acquired immunity. So let's talk about it. What is it, okay? Specific, adaptive, or acquired immunity. It's intelligent identification of the invader based on its antigenic properties. A specific antibody is made for a specific antigen. An example of that would be the antibody to strep. Does not work against pneumonia. So let's talk about how the third line of defense works. So T cells and B cells work together specifically to destroy the invader or render it harmless. They're also capable of developing memory so that at a second encounter with the same organism will induce a heightened and quicker immune reaction. So T cells or T lymphocytes provide cell-mediated immunity. Of the lymphocytes circulating in the blood, 70 to 80% are T cells. T cells become involved at the site of invasion where they are activated after they receive an antigen presentation from macrophages. Once activated, T cells rapidly duplicate themselves into clones that differentiate into 4 subgroups. We have killer T cells, which we have T cells, T8 cells, or cytotoxin cells. They directly attack foreign antigens and destroy cells that bear the antigen. Okay, so remember 8-year-olds like to kill things? T8 cells. Okay, these are just little fun tips, guys, trying to help you, because I know this is a lot to remember for the test, okay? So just study tips to get you to lock this stuff into your mind, okay? Okay, so the helper T cells, also Th4, CD4, or T4 cells, these cells stimulate other T cells and B cells to produce antibodies. These cells are counted to see the damage HIV is doing to the immune system, okay? Because the fewer T cells you have, the more damage is being done to your immune system, which means you lack immunity, and that's why patients with HIV get all these opportunistic, odd diseases that they don't normally see people get, because their immune system is so weakened, they get sick off of things that most people don't, okay? So when you hear about people checking their T4 cells, their T4 count, this is the way they're trying to see how damaged the immune system is. Then we have suppressor T cells. They inhibit the T and B cells after enough cells have been activated. Because we don't want it to go overboard. We understand that with cancer, sometimes we get a mutated cell and then it goes overboard, making all these mutated cells, and then you could have a mass or a tumor that's cancerous. We need to keep all this stuff in check. We need to make enough of them to fight off the disease, but we don't want them to go haywire and continue to make more than what we need. And then we also need the memory T cells. Remember the antigen for future encounters. They are ready to respond to the subsequent exposure to the specific antigens with increased speed and intensity. It's like I told y'all, guys, if you got sick with something and you built up an antibody to it, then that's why you don't get sick like that the next time, because those cells now can get after it really quick and really fast so that they can get rid of them before they ever make you sick. So guys, again, these are just things I want you to use these slides as a way to study. So you can pause this one now, take out a piece of paper, and see if you can answer each one of these questions at home. Okay, so what are the names of the 2 main types of lymphocytes involved in the 3rd line of defense? We know they're T cells and B cells, right? Okay, now B cells or B lymphocytes provide humoral immunity or antibody-mediated immunity, okay? Humoral immunity begins with the interaction of a B cell with a specific antigen and the lymphokine, or a small piece of antigen, from the T helper cell. Once it is activated, B cells rapidly duplicate into a clone and differentiate the two subgroups. Remember, body fluids are in humors? We have plasma cells. They produce the antibodies, or immunoglobulins, that travel through the blood, specifically targeting and reacting with the antigens, resulting in the destruction of the invader. Your memory cells remember the antigen for future encounters. They also are ready to respond to the subsequent exposure to the antigen, okay, to that specific antigen with increased speed and intensity. Okay, here's one of our case studies. Pause it, read through it, and see if you're putting this all together. Okay, so here is that question that's in your review guide in your black binder. Because as I always say, guys, we want to be able to learn, to absorb this stuff, to learn it, and to be able to then speak intelligently about it, right, in our own words. To describe in your own words the difference between the non-specific and specific defense mechanisms the body has in defending itself. Include how the first, second, and third lines of defense work. You want to make sure your answer contains that non-specific defense mechanisms work against all foreign substances in the same way. Specific defense mechanisms only work against the foreign invader they were formed to work against. First line of defense is your skin, mucous membranes, coughing and sneezing. They all work non-specifically against all invaders. Your second line of defense is WBCs like neutrophils, monocytes and lymphocytes, and plasma proteins like interferon and complement, and inflammation, and they work non-specifically. Your third line of defense is the only specific one, and that deals with T cells and B cells. Your T cells are killer, helper, suppressor, and memory, and your B cells are plasma and memory, and they work specifically just against that specific antigen. Ways to acquire specific immunity, right? So once a specific antibody is present in the blood, the individual is said to be immune to its particular disease, pathogen, or antigen. Specific immunity can be acquired in 4 ways. Active, which is long-term immunity acquired naturally, like contacting the disease. Okay? Now, again, this is a way that this can be done. You can naturally acquire active long-term immunity through contacting chickenpox. The only downside to that way, and sometimes it's sadly the only way, is with a lot of these diseases, even with something like chickenpox, it has been known to kill. It has been known to leave you, if you don't die, with long-term complications that you have to live with. And then sometimes it's uncomfortable. It leaves scarring, things of this nature, okay? But sometimes it is the way to do it, and you do live through it, and you have little issues, and you go on to be immune against chickenpox. So that's one way. Then there's also active, and you'll see active, passive, and natural and artificial, right? So the next one we're looking at is active, and it's a long-term immunity, and it's acquired not naturally but artificially when you receive a vaccination, okay? Then there's passive, which is short-term immunity acquired naturally. When a baby is born, one way that they help build their immunity up is they receive antibodies through the placenta, and they can receive antibodies through breast milk. That's why we always strongly encourage women to breastfeed their children if they can with their breast milk, but because it helps your baby be able to build up their immunity sooner. But that's passive and that's natural. Then we have passive short-term immunity, and we see how active is long-term immunity and passive is short-term immunity, right? So we have passive short-term immunity that's acquired artificially. If we receive an anti-serum with antibodies from another person, okay, that doesn't give us long-term immunity, but it can give us short-term immunity to help us through a situation. And it's artificial because we didn't naturally get it from a natural situation, right? So make sure you know the difference between active and passive immunity and which ones are naturally acquired and which ones are artificially acquired. So we remember active long-term, right? Active natural, right, is you can contact the disease and produce memory cells. Active artificial is receive a vaccination and produce memory cells. Passive short-term is getting it from your mother's breast milk or placenta as you are born, or by getting antibodies that someone else produced in an anti-serum that is given to you, okay? So what is the difference between active immunity and passive immunity, okay? We went through this, right? Active immunity is that long-term protection against future infections because the individual is exposed to the antigen and the antibody they form is remembered in the memory B cells, making the individual immune to future encounters with that same pathogen, okay? Passive immunity is a short-term protection against infections and is only temporary. The individual receives the antibody and does not make their own, okay? If you receive that antibody in an IV, it will help you right then get better. We've seen them use some of this in the treatment of COVID-19, but it's not going to make you produce an antibody because it's not an antigen, it's the antibody, right? So the antibodies in your bloodstream, it will help you fight off the disease or protect you from that short term from getting COVID-19 until you can get immunization, but it's only short term. So know the difference between, like I said, the active and passive. Okay, so what I want you guys to do is sit here and see if you can figure this out. Okay, say to yourself, you received the flu shot. Then is this active natural, active artificial, right? We know you received the flu shot, so it's not natural, right? It's something artificial given to you, right? And we hope that it can be long term, right? But with the flu shot, because it's a virus, we have to get one every year. So it's really a passive artificial, right? So you guys go through each one of these, right? And see if you're getting the right thing, okay? Because remember, a patient in your office receives IV of antibodies. That is not active, right? It's going to be passive. And it's artificial because you didn't make it yourself. Your son or daughter has measles, okay? That's natural because you naturally came in contact with it, and it's active because it's going to be long term. And then if you passed on resistance from some cold germs to my child before she was born, remember, that's natural, but it's going to be passive because it's only short term, right? Remember, we're going to talk about the classes of antibodies or immunoglobulins, right? Antibodies are part of the globulin group of proteins that circulate in the blood and referred to as immunoglobulins, Ig, right? How are immunoglobulins classified? They are classified into groups based on their shape, locations, and functions. So you make sure you understand that they're classified by these three groups. So now we're going to go all over each immunoglobulin because Ig is the immunoglobulin, right? So we have IgM is the primary responder, is the first encounter with an invading agent. So you think about a paramedic, medic M, right? Medic, That's the person they send out onto the battlefield or out to the emergency. That's the first person that's going to get to that sick or injured patient, right? So think M, medic, that's the first responder. It's the one that first encounters that invading agent. IgA protects mucous membranes from bacterial and viral infections. So you think about mucous membranes, sneezing, allergies, right? A for IgA. IgD is involved in lymphocyte activation and suppression. Okay, so you activate them, then when you have enough, you suppress them. So you think downers and uppers, D, right? Downers, uppers. Okay, IgG responds to the invading antigen in subsequent encounters. Okay, so second guard, right? G, second guard. They are not on active duty. IgM, that's the medic, the primary. IgG, second guard. They're the second one on duty. They respond to the invading agent in subsequent encounters, right? Not the first one. IgE is involved in allergic reactions. So think about allergic reactions, you get an EpiPen, right? E, IgE, okay? And remember, spell woman's name Madge. If you think of Madge, then you'll know IgM, IgA, IgD, IgG, and IgE, okay? Because this is going to be a lot in chemistry and immunology to start to memorize. So pause this one and see if you're going to get the right answer. Okay, so now we're going to talk about two types of allergy testing. Immunology tests visualize a specific reaction between an antigen and its specific antibody. What are two types of immunology tests? We have in vivo immunology tests that take place within a living organism. An antigen is injected or pricked into the skin to see if the body has an immune reaction to it, which is seen as a red whelp, raised induation like we see in TB testing, okay? Then there's in vitro, which is immunology tests that place in a laboratory outside the body. Antibodies or antigens associated with disease are detected in body fluids by mixing them with their specific antigen or antibody and noting the reaction chromographically or by observing a color reaction. So we're still talking about in vitro immunology tests, okay? So a liquid body fluid specimen is absorbed and travels across a testing area that enzymatically changes colors if the antibody-antigen reaction takes place. An internal control must turn colors to prove the testing device is working. The control area is usually located just beyond the test area to ensure the solution has traveled all the way through the testing area. So you'll see a little example over here to your far right, and there's a lot of really good examples in your textbook. You see number 1 to your far left of this test, you have C for control and then the test, and neither one of them are lit up, okay? So that either has not been used yet, okay, or it's not working, okay? Because the control has to work. If the control doesn't light up, that means something could be wrong with that particular kit or a pack and you don't want to use it. Number 2, you see a line on the control, which means the pack worked, the internal control worked, and then you've seen a line on where the test is, so that might be a positive, okay, for pregnancy, because I can see this is an HCG pack. And then the third one, the control is positive, which means that's good, your internal control worked. And then there's no line at test, which means this one would be negative for pregnancy, okay? So you guys see how this works, okay? So what do you call the type of immunology test where body fluids travel across a testing area that enzymatically changes colors when an antigen-antibody reaction takes place? It's called a lateral flow immunochromatographic assay. Okay, lateral flow. And these are close up, right? So you can see that control has to come in. Now, when you open up a new kit, it has a whole bunch of pregnancy tests in it, right? The first when you open the kit, other than reading the package insert and making sure you're familiar that it works the same way, right? And then you put your package insert in a book that you keep in your lab, right? You're going to take out one of these packets and you're going to run controls on it. Remember, we have to run 2 levels of control every 8 hours of a shift. So I would need 2 of those packets. I would run a positive pregnancy control and a negative pregnancy control. And so then I need one that looks like number 2, and that should be my positive control, okay? And then I would have one that looks like number 3, and that would be my negative control. So once I've run my external controls that I have, then I note that in my book and note it on the package. And now when you come in the next day or later in the day and you have another pregnancy test order, you don't have to run those controls again. You just have to make sure the internal control works. I hope y'all understand that. And if you have any questions about it, reach out to me. Remember, when you open a new pack of them, you run controls on them, a negative and a positive. Now, while you're running them, not only does the negative need to come up negative and the positive needs to come up positive, but the control also needs to show up. Okay? Then the rest of that kit, you don't have to run controls on it anymore. You just have to make sure your internal control works. Now, when you used up that whole kit and you have to open up a new one, then you need to take 2 out and run a positive and negative again. You run controls each time you open up a new testing kit. Okay? So we want to be able to name 9 different tests that use lateral flow immunology, okay? And these are CLIA-waived enzyme-linked immunoassay tests. These are tests as medical assistants or lab assistants you may be running in your physician's office labs. The first one is a pregnancy test, right? What we just saw. Bladder tumors associated with antigens, mononucleosis, H. pylori, which is responsible for stomach ulcers, a lot of cases, right? HIV, we got a fecal occult blood test that is this type, influenza A and B, strep A, and drug testings. These are all tests that use lateral flow immunology. So what is the difference between direct test kits and indirect test kits? Okay, so direct test kits provide the antibody in the kit and test for the antigen in the specimen. Okay, that's direct. Indirect provides the antigen in the kit and tests for the antibody in the specimen. Okay, so know the difference between the direct test kit and the indirect test kit. In both cases, a color reaction occurs in both antibody and antigens are present, and the results are recorded as positive. If the color reaction does not occur in the test area, the result is recorded as negative. And that internal control must always work. So pause this one, read through it, and see if you're getting the right answers. Okay, so we're still talking about these CLIA-waived enzyme-linked immunoassays that you guys very well could be running in your physician's office labs. Now, we all know that HCG, right, is the hormone that is produced when you're pregnant, and that's how we detect that hormone in your bloodstream to let us know that you're pregnant, right? It is produced by the chronic villi of the placenta of pregnant women. You'll see a little close-up of that. So once you have that placenta, and you would need that to be pregnant, right? Then it produces that HCG hormone that now can be detected in your bloodstream. It can be detected 1 to 5 days after conception, okay? It peaks at about 50 to 80 days after conception. So very early on in a pregnancy, we can detect these HCG hormones to tell if you're pregnant. So is the HCG the antigen or the antibody? Antigen. If it doesn't say it's an antibody, it's an antigen. So how do we collect that specimen? Okay, so we collect a first morning urine specimen, and we talked about this before because it will have the highest concentration of anything, right? Your first morning urine is the most concentrated, so it's going to have your highest concentration of HCG. The urine specimen container must be free of detergents. Urine should be refrigerated if not tested immediately. Once refrigerated, it must be brought back to room temperature by letting it sit out for an hour prior to testing. What are some of the things we need to remember when performing a pregnancy test? Check urine-specific gravity results. Levels below 1.010 may give a false negative result because of a diluted specimen. Okay? You bring test kits to room temperature prior to testing and do not use expired kits. Okay, so if you see that your doctor ordered a pregnancy test, you want to immediately get the kits out so that they can come to room temperature. We always want to check the expiration date, and we always want to check to make sure controls have been ran on that batch of kits. You never want to use in any enzyme-linked immunoassay testing, never use supplies or reagents from one kit with another. If somebody tries to tell you that's what you need to do, you need to explain to them that is something that never should be done. Never assume the instructions for different test kits are the same. And whenever you get a new test kit in, you never know if they changed something. So it's always a good idea just to double check that package insert to make sure they haven't changed any way they're doing this test. Qualitative test results will show a negative or a positive. Chart as positive for pregnancy, or negative for pregnancy, or positive for pregnancy. Again, here's one of our case studies. Pause this to see if you're putting together the things you're learning in both lab and lecture. Remember, you want to be using the package insert that comes with that kit. I have seen times where we were using the same kits over and over, and we get a kit in, it looks the same as it always did, but when we open it up and check the package insert, we see that they're using a different amount of blood or a different amount of urine. So please always check that package insert just to make sure it's being done the same way. So now let's talk about mononucleosis testing. So what is the causative agent of mononucleosis? It's EBV, or Epstein-Barr virus, right? It's called the kissing disease because it's transmitted by direct oral contact through saliva. It's an acute infectious disease frequently seen in teens and young adults. Mononucleosis can cause a fever, fatigue, sore throat, and swollen lymph glands. So how do we diagnose mono? We have three different ways, okay? First, your clinical symptoms: mental and physical fatigue, severe weakness, headache, fever, sore throat, and swollen lymph nodes. Then you have your hematological findings: increased reactive or atypical lymphs show up on your differential. And then you have immunologic testing, shows an increase in heterophile antibodies, the antibody to mono. And so you see, we're going to take those clinical symptoms that they're telling us, then we're going to do a CBC, and we're going to look at this diff, and we're going to probably see an increase in reactive or atypical lymphs. And then down here at the bottom, you see we're going to run a mono test. Okay, so when is the heterophile antibody first produced, and what percent of patients develop it within 3 weeks? So it's produced by the 5th to 8th day after you're infected, right? 80% of patients have a detectable level of the antibody within 3 weeks. In the 20% of patients who do not produce the antibody, that diagnosis depends solely on the clinical and hematological findings. There are 20% of those patients that just are not detectable. It does not mean they don't have it, okay? The heterophile antibody is the name of the antibody specifically formed against mononucleosis. Most of the time, the antibody is not named. Here's another one of our case studies. Pause it, read through it, and see if you're getting the correct answers. Okay, now we talked about H. pylori or Helicobacter pylori testing, right? So what is the causative agent of most but not all duodenal and gastric ulcers? H. pylori, right? It's a spiral-shaped bacteria. So how does it cause ulcers? It weakens the mucus lining of the stomach. Stomach acid then is able to penetrate the sensitive lining beneath the mucus layer, and the acid and bacteria then cause an ulcer inside the stomach. Okay? Now, a big part of stomach ulcers come from this H. pylori. Not all of them, but most of them. Okay? So what's the symptoms? You have that gnawing pain in the abdomen after eating and during the night. Symptoms are relieved by eating and taking antacids, right? So how are they treated? With antibiotics that kill the H. pylori and drugs that reduce stomach acid. A lot of times they'll also give you something like Melana or something to drink to help you coat the inside of your stomach. So how does the immunology test work? It tests for the antibody to H. pylori, okay? So here is our higher order learning activity, right? This is one of our case studies. So you guys pause it now and read through it and see if you're getting the correct answers. Okay, now there is a test for HIV, the human immunodeficiency virus, right? HIV attacks and destroys WBCs, helper T cells, CD4 lymphocytes, and the cells monitored with HIV, right? Transmission of HIV is primarily through sexual contact and the sharing of needles with infected persons. Remember, helper T cells protect the body against infection through cell-mediated immunity. They also help B cells produce specific antibodies through humoral immunity. When helper cells are destroyed by HIV infection, the body becomes less able to fight infections and becomes more susceptible to opportunistic infections. What point about testing positive HIV does AIDS occur? Okay, at what point do you go from being HIV positive from having full-blown AIDS? So acquired immune deficiency syndrome, also known as AIDS, is defined by the presence of life-threatening infections and life-threatening forms of cancer. You can be HIV positive and are not sick. You're taking your medication and your T cells are in high enough numbers to keep your immunity up to where you are not in full-blown AIDS, which the way we define that is when your T cells get so low, you're opened up to these different kinds of cancers and infections. So when handling specimens for HIV testing, healthcare workers should adhere to the OSHA bloodborne pathogen standards, such as wearing PPE and disposing of contaminated materials in the proper place. But guys, you know I preach this in lab every day. We need to treat every sample, every reagent, every control like it could possibly have something that could kill us. We always, always need to wash our hands, wear the appropriate PPE, and keep our areas clean. We need to clean between every patient, change our gloves between every patient, and wash our hands between every patient, okay? So how do reference labs test for HIV? Okay, serum is used to detect the HIV antibody. In physician office labs, we have the enzyme-linked immunosorbent assay, ELISA test, is used first and is confirmed by the Western immunoblot method. So if they come in, you will have this ELISA test that you do. If it's negative, then you report it out as negative and things move forward. If you get a positive ELISA test, then you will send it off for your Western immunoblot method to confirm the diagnosis of HIV. So how do physicians' office labs test for HIV? They have CLIA-waived HIV tests that detect the presence of the HIV antibody. So what type of specimen is used for the waived HIV test? Blood or oral specimens are used. OraQuick, the picture you see right here, uses a specimen obtained by thoroughly swabbing the outer gums, both upper and lower. And you will see an example. They, at the top, over to the right, they take that OraQuick swab, place it in their patient's mouth, over to the far left, my left, okay, be their right. Stick it in there, run it against the gums all the way over to the other side, okay? The swab is then placed in a vial with developer solution that provides results in 20 minutes. A positive test shows a reddish purple line in a small window in the testing device. Internal and external controls are provided in the kit. So here's one of our learning slides. So like I said, guys, always pause these, take the time to read through them to make sure that you're getting the correct answer. This is a fantastic way to study. So fecal occult blood testing using the IFOB kits, okay? So how does the rapid immunochemical diagnostic test for fecal occult blood work? First, the patient pierces a fecal specimen with a blue inner probe located inside the tube. After mixing the specimen with the buffer solution, it is mailed to the physician's office lab or testing lab. Okay, so now let's talk about some more advanced concepts. Okay, agglutination reaction. These are non-CLIA waived tests. Okay, so these are most likely tests that medical assistants and lab assistants would not be running. Okay, but we want to talk about these. So we want to describe an agglutination reaction. Agglutination occurs as a result of an antigen-antibody reaction that causes the visible lattice-like clumping together of blood cells or tiny latex beads. The reaction can be seen in a test tube or on a slide when we did blood testing. Agglutination reactions are not CLIA waived and must be performed in a hospital or reference lab. Okay, so ABO blood typing, okay? This is one of those agglutination methods, okay? ABO and RH is determined by agglutination testing. So what are the 4 reasons for determining your blood type? Why would we want to determine somebody's blood type? First and foremost is for safe blood transfusions. If you need to have a blood transfusion or you may possibly need to have a blood transfusion in some type of surgery, then we want to know your proper ABO and RH type so that we can do safe transfusions. If we need to know what the mother's blood type is, and so we can have prevention of hemolytic disease of newborn in case the mother is RH negative. If we need to identify who the parents of the child are for paternity testing, we can test to see if it's possible that this child belongs to these people, and also in forensic criminal evidence, right? We want to type the blood we find at the blood scene to see if it's the killer's blood, if it's the victim's blood, right? Here's some examples over here to your far right-hand side. At the top is agglutination in a test tube. You see that blue in the background. You see that little clump, okay? That's agglutination, and you see down here in this bottom is on a slide, and the one is anti-A is a gluten, the anti-B is not, and anti-D is a gluten. You see agglutination, so that means they're A positive. Remember, there are more than 300 different types of inherited blood antigens that are found on the surface of RBCs. So why are the ABO and RH antigens the most important of these antigens? Because of the intense antigenic response when transfused to incompatible recipients. So in other words, there's over 300 different inherited blood antigens on your RBCs. But you may come in contact with one of those and have some reaction, but it's not a very strong reaction, and it's really not going to kill you or ruin your kidneys or anything like that. But with the ABO and RH, they have the most intense response, and they can cause kidney failure, they can cause death, they can cause a lot of real serious problems. So we always want to make sure we test for those. How is your ABO blood type determined? By the presence or absence of A and B antigens on the surface of your RBCs. Individuals with A antigens are type A, B antigens are type B, AB antigens are type AB, and if you have neither A nor B, you are type O. Landsteiner discovered the ABO blood groups in the early 1900s. So what naturally occurring antibodies are present for the 4 blood types? So type A produce anti-B antibodies, type B produce anti-A antibodies, type AB produce no antibodies, and type A produces both anti-A and anti-B. Blood typing is performed to determine the compatibility between a donor's blood and a recipient's blood. What would happen if a patient was given the wrong type blood? If a blood antigen comes into contact with its corresponding antibody, the result is agglutination or clumping of the RBCs. Eventually, this can lead to hemolysis, which is breakdown of the RBCs. The clumped red blood cells cannot pass through the kidney, which may lead to kidney failure, death. What type is the universal donor, and which one is the universal recipient? O is the universal donor, okay? And AB negative is the universal recipient. So anyone can get O, and AB can get anything else, right? So how is ABO blood type determined in the lab? To determine ABO blood type, the fact that specific antibodies react with specific antigen is used. So what we do is we take serum, right? If anti-A agglutinates with the RBCs, the blood type would be A. If the B agglutinates, we know it's type B. If both A and B agglutinate, then we know it's AB. And if nothing agglutinates, we know it's O. Like I gave y'all the example you see down there on that bottom over to the far right. It agglutinated in anti-A. You see no agglutination in anti-B, and you see agglutination in D. That means that person's blood type is A positive. So pause this one and see if you're going to get the right answers. These blood typings can get hard for people. Y'all make sure you study it so you're understanding it, okay? And again, reach out to me if you have any questions, comments, or concerns. I'll be glad to help you. So how is positive or negative blood type determined? Those with the Rh antigen D on the surface of their RBCs are considered Rh positive. And they comprise 85% of the population. So 85% of the people are Rh positive. You're rarely going to see an Rh negative, okay? Individuals who do not have the Rh antigen D are Rh negative and comprise the other 15% of the population. An Rh negative person has no naturally occurring Rh antibodies called anti-D antibodies. Anti-D antibodies may be induced after an Rh negative person receives Rh positive blood or after an Rh negative mother has an Rh positive baby. Okay? So if you are Rh negative mother and the first child you have is Rh positive, nothing's going to happen to that baby, but once you have that baby and the two bloods come in contact with each other, now as the mother, you will build up anti-D antibodies, okay? And then you could attack the cells of future babies, causing hemolytic disease of the newborn. Okay? HDN, or hemolytic disease of the newborn, okay, is a hemolytic anemia. They have jaundice, an enlargement of the liver and spleen in newborns. Cardiac failure, respiratory distress, and death often occurs. It results from a mother who is Rh negative who forms the anti-D antibody after the birth of her first Rh positive child, due to the mixing of the baby's blood with hers at birth. HDN would not occur with the first child. So how can we prevent hemolytic disease of the newborn? It can be prevented by the injection of the anti-D antibody, or RhoGAM, during and after the pregnancy of an Rh negative mother. RhoGAM prevents the mother from becoming synthesized to the Rh antigen. So here's another one of our things that are inside our review guides, right? Where we're able to absorb this stuff, learn it, and then be able to talk intelligently about it in our own words. So you want to describe in your own words how Rh incompatibility affects unborn babies. Include firstborn and subsequent birth babies, how the mother's blood type is connected, and how RhoGAM works. So here's one of our case studies. Okay, pause this, read through it, and see if you're getting the correct answer. Okay, so let's talk about, we talked about these ELISA tests, right? Let's talk about the quantitative analysis, okay? So when are quantitative enzyme-linked immunosorbent assays, ELISA tests, most commonly used, and are they CLIA-waived? Okay? So for allergy testing, no. Okay? They are not CLIA-waived for allergy testing. How does the term immunosorbent mean? Immunosorbent penetrates, absorbs, right? Penetrates to the attachment of an antigen or antibody to a solid surface such as latex beads, wells in plastic dishes, or plastic cartridges. Okay, so now how does it work? Okay, so the thing you got to remember is what they do is they take the antigen, right, and they fix it to the inside of this dish, right? When I say fixed it, it's fixed in there so that when they rinse it, it will not rinse away, okay? But they fix it to the inside, then they rinse it just to make sure everything's clean, and that's all that's in there is the fixed antigen. Then a serum specimen containing the antibody is added into that dish, right? And then you have to wait. Now, if the antigen and antibody are in there together and they're the same, they will bind together, right? So if that happens, then you're going to rinse that well again. If that antibody is not specific to that antigen, then it will not bind. And when you rinse it, all the antibody will be removed out, okay? If it fixes, okay, if they bind to each other, okay, then the antigen and antibody will stay in there. Then next, an enzyme antigen that will bind to the antibody is added, and the well is rinsed again to remove any enzyme that is not fixed. An enzyme color developer that will react with the enzyme is added. If the serum contains the antibody specific to the antigen, then a color change is going to occur that you can see. And just think about it like this: the more the antibody present, the darker the color. Let's talk about titers, okay? Because now, used to, you get your shot records before you go to clinicals, you turn your shot records in, we'd see that you got your immunization, and that'd be check a box and you go to clinicals. Now, they don't really just want to see that you got your shots. They want to see that you're still immune to these things. So that's why now, if your titer's not high enough, then you don't have immunity. We want you to get a booster for measles, mumps, rubella, whatever it may be, right? So a titer is a quantitative, non-CLIA-waived method to determine the amount of a specific antibody in the blood. So you want to make sure they have enough of that antibody in their blood so that we know that they have immunity to whatever it is, okay? It is a test that measures the extent to which an antibody can be diluted before losing its power to react with a specific antigen. There comes a time when your antibody is so low, it won't do the job, okay? So a series of dilutions of an antibody is made. The weakest dilution that still shows a reaction is reported. How is a titer used to treat hemolytic disease in the newborn? A titer provides the physician with information about the quantity of antibody in the patient's body. A series of Rh antibody titers monitors the degree of sensitivity the mother might develop against the Rh positive baby's cells during the pregnancy. If the titer rises, appropriate measures to protect the baby are taken. Okay, guys, I know this is a long chapter and this is a long PowerPoint presentation, but not only is it going to help you in this test and help you out there in the workforce, okay, but if you decide to continue your education, which I hope you all do, and if y'all need any help with continuing your education, please feel free to reach out to me. If I don't know what to tell you, I can get you to somebody that will, okay? But this is important because if you continue your education, these are things you're going to need to know, okay? So in this chapter, okay, we talked about the immune process, how to differentiate between cell-mediated humoral immunity. We talked about the 4 ways to acquire adaptive immunity, the classes of immunoglobulins, IgA, IgM, IgG, right? The principles of in vivo and in vitro immunology tests, whether you like with the TB test under your skin and it happens inside your body, but it's a test to see if you're positive for TB or whether you do it in a laboratory testing like your pregnancy test or other tests, right? We talked about pregnancy tests, infectious mononucleosis, and H. pylori. We also talked about different CLIA-waived testing for HIV. So here are some of the key terms. I'm going to go through these. If you think you've studied all you want, you don't want to study anymore, you don't have to use these. You can stop this now. Read chapter 7 in your textbook. Watch this, fill out your guides, and then start studying them, okay? But if you want to use these as a way to study, then I'm going to flip through several of these slides to kind of help you make sure you're keying in on these key terms as you know they're going to be on a test. So pause them and then start it back up to see if you're getting the correct answer. Okay, we also talked about in this chapter ABO and RH typing, how RH incompatibility can use erythroblatosis. We talked about advanced techniques. We talked about titers, right? Okay, guys. So you should have already finished doing all the stuff for chemistry. Finish up this, and your test will be before you know it. So as soon as you come back from, most likely from fall break, if we will, that test will probably open up that Monday, right after a fall break, and close that Wednesday. So remember, that Monday that you come back from fall break, this test will be up on Canvas for chapter 6 and 7. Okay? It will probably open up that Monday at 8 a.m. and then it will close Wednesday at midnight. Remember, you will not have an individual test for chapter 8, but I will have those PowerPoint presentations up on Canvas during your fall break and during Thanksgiving. If you're just wanting something to do, you guys can watch those. Some people are very proactive and get ahead. Other people's don't, but that's fine. I want y'all to enjoy your fall break and your Thanksgiving and be safe out there. And then remember, once you finish this test, mark it off your list. Make sure you are responsible for chapter 8, and then study your lecture study guide for your lecture test. I will be getting with the graduates that are going to graduate. You were supposed to send me an email, and I'm going to be getting on with you in the earliest chance in December to get your test taken so we can get your grades posted. And then everyone else will take them during that time, and I'm going to let you guys know about that too. And then remember, now we are fully, the rest of it, because it was a hybrid lab, so we've been in lab every Monday since the start of school, and now we'll finish out the remainder of our labs on Canvas. So be looking for those PowerPoint presentations from the lab. You guys have a great holiday and stay safe.